That's for you keep care.
Okay, well, this is inpatient, so that
When their patients are inpatient,
Yes.
it doesn't mean she's working inpatient. It means that she's case managing their patients while they're not.
with healthcare partners, that usually means on-site visits, but we can clarify. At least that's what it was when I was there, and they would come, they would be the ones that would come and do the evals.
She worked. That she did was.
Okay, Meredith, we're ready, if you want
Okay.
to bring her in.
I'm just setting up the,
I think that's her up there.
there we go. Okay,
Yes.
you ready?
Yeah. Me too.
Goes online, right?
Yes.
She look at that. I did. Who's gonna moderate the,
How's
I'm
Carl?
gonna guide us through the questions?
We could set you up. Hello. Hello, everyone.
How are
you?
Good afternoon.
And your PowerPoint is,
Do we need to close the door?
yeah, I will.
Yeah. Sure, is it somebody else?
I don't think so. We will. So welcome, Shetona. I'm Melinda Dickon. I'll be kind of facilitating our time this afternoon. I'm the chair of the undergraduate nursing program, so I'll let everyone kind of introduce themselves as well as we have someone online. Okay. Elaine, you want to introduce yourself?
Elaine.
Okay, welcome. Nice to meet you.
And I'm Vanita Heiskes. I'm the Associate Dean for the Graduate Division of the School of Nursing.
Chair of the master's program.
How you know me?
So we will start with your presentation, and then we'll lead into some questions that the search committee will ask.
Okay.
Thank you.
First of all, I want to thank you guys for taking the opportunity to interview me. So this presentation is about patient assessment. So generally, I put PowerPoints on the boards, and I don't verbatim read them all to the students, but I just do a random, I talk about safety, quality, education, and nursing. And I ask them, do they understand what QSIN is, what it's all about? I tell them where it came from. It came from the Institute of Medicine, and it's an interdisciplinary task. Do I have to sit here, or can I stand?
Do whatever you're comfortable with.
Okay, it's better for me to stand, I'm sorry. And then I talk about what it means for nursing and how that works and how that relates to our practice. Okay, I tell them that there are 6 components of QSIN. It's patient-centered, it's informatics and technology, it's all evidence-based, it has quality improvements embedded in it, it's all about safety, teamwork, and collaboration. And I always open it up so that the students, if they have any questions about any of those 6 or any of the slides that I presented, that they may ask any questions about QSIN. So within QSIN, we always have to have the nursing process. And so the nursing process, as we know, starts off with assessment. And the assessment can be subjective or objective data. In there, we have our diagnosis, where we get that from data analysis, and our problem identification. Our problem identifications come from all the information that we get from the patient subjectively and objectively. Then we go to our assessment plus our diagnosis equals our nursing diagnosis. And we start working and implementing those ideas and those plans pertaining to our patient. When we're looking at the planning phase of it, we do priority diagnosis. We establish a nursing care plan, and then we look for our expected outcomes. Is it our nursing outcomes classified, which is NOC, or is it our nurses interventional classification, which is NAC? Then I do one of two ways. I can start off by giving them a head-to-toe assessment and ask them to read the head-to-toe assessment and see if they can point out any disparities or any problems that they can identify. I give them that. We read it over. I have them take a few minutes to look at it and allow the students to talk about it. So if they don't say anything, then the first thing I talk about is, so why did I look in the patient's mouth? Why is that important? And I say, well, you know, the patient could have an NG tube. They could have anything. They could have sores in their mouth. We need to look inside there. If we're dealing with an elderly, we need to make sure that they have their teeth and that they can eat properly. Then I further look at the lung sounds. The lung sounds say diminished breath sounds. Is that a problem? If they say yes, okay, what kind of problem is that? Explain to me what that means. And that has to be with the nurses understanding lung sounds and having listened to lung sounds. What can you do for those abnormalities? The patient is coughing. He has an occasional productive cough. It's thick. Is non-color. And there's no odor to the phlegm. What kind of teaching do we do with that? I ask the students to look at that. The abdomen is soft, slightly distended, with high hyperactive bowel sounds. They have no pain, no abnormalities found on their assessment. They have the IV in the forearm. The patient is voiding freely without any complaints of urination. The patient can walk without any difficulty. And then I look at the pulses on the patient's extremities. Usually when we talk about a head-to-toe assessment, and when I'm in the clinical environment, students say, you know, Professor, when I get in there, I just get so nervous. I get so panicky. I don't know what to do. So one thing that I did, I created a card, and I'm sorry I only have one, but I can show you what I give to my students. I'm having them print it right now. I give this assessment card to my students, and they can put it on their badge. And so it helps them identify. I tell them the first thing that you need to do when you go in your patient's room, not come in there with gloves on, because the patient may think, what have you been doing with those gloves? So you need to come in and knock on the door. Hi, my name is Shetona. I'm going to be your nurse. I'm going to wash my hands today. How are you feeling? Look at them. Talk to them. See how they're responding to me. And then I tell them, then you start conversating with them and start telling them that you're going to do the head-to-toe assessment, and start from the head and proceed down like the card instructs them. I think on there it goes down into neurology. So you ask them, are they, if a person is awake and alert and oriented, you don't need to ask them those questions. However, if they have a diagnosis of dementia or any type of problem like that, well, then you need to seek more and make sure that they're awake, alert, and oriented. Do you have somebody that's a sundown, which means after 5, they're going to start going down here and getting a little confused. And so I take them through the whole assessment and how to use the tool and how to help them. I also try to help my students understand that the assessment is the key foundation to taking care of the patient. If you don't have a good assessment, then you really don't have good grounds for what you're doing for the patient. We need to understand why we're doing it. It's not just because the doctor wrote an order that it has to be done, but you need to understand why that needs to be done. Sometimes there can be oversights, i.e., my husband this Tuesday he knows he's allergic to amoxicillin. The doctor gives him amoxicillin, and he goes and take amoxicillin. So Tuesday we end up in ER all night. So sometimes there are all kind of data and stuff there, but we have to reassure ourselves of what we're doing. And that's why CUSIN methodology is so important. We have to learn how to bridge the gap between what the students is getting information in the theory and lecture part of it into what is actually they're finding in the clinical, and bridging that understanding between the two. That's why I think the assessment is very, very important. That's why I use the CUSIN tool as a good method of helping me get my students on the train to understanding the nursing process, which will help them give the patient a better outcome.
Thank you so much.
Okay, thank you. Gonna get into flight.
Sorry.
That's okay. That's okay.
Okay, we'll go ahead and ask you some questions now. I'll go ahead and start, and we'll just kind of go around and circle this way. And then if one touches on another item, maybe you don't have to ask every single one. So please tell us briefly what you know about APU and the School of Nursing and what attracted